Today we're going to talk about the GI tract. So this is what's talking about the GI tract. And I'm going to go ahead and show you some things about the GI tract. But before we go there, I want to tell you the importance of drinking your water, because the GI tract is made up of 70% water, gastric juice, hydrochloric acid, you name it. It's all water needed to break down the food. Now, let's go to the function of the water for the GI tract. It prevents bad breath. That's the first one. It prevents bad breath by drinking your water. It helps with peristalsis. Peristalsis is movement to get the food out of your GI tract. Your GI tract is 35 feet long. Wow, nobody knew that, right? 35 feet. So that's a long process to get water and food through. So it takes about 10 hours for it to get in and get out, unless you have some problem with, diarrhea or constipation or stuff like that. But it shouldn't take more than that. So every morning, you should be getting up, and at the end of the day, you should be using the bathroom again at least twice daily, okay? If your stomach is working right and you're having enough fluid. So at least twice daily, at least 10 hours to excrete. Okay. It aids in digestion, which help with the enzymes and hydrochloric acid. It aids in metabolic changes. It prevents constipation. Water prevents constipation. It helps your body to absorb your nutrient. It takes nutrients to the vital cells and organs. It helps convert food into energy. It prevents kidney stone, gallbladder stone, all those stones you know about. It prevents that. It removes waste product from the body, and water helps with healthy weight loss. Now let's go on to the different parts of the GI tract and what it's for. The digestive organ, also called the gastrointestinal tract, also called the digestive organs. This digestive tract starts from your mouth straight to your anus, which all the organs of the digestive system. We're going to list them. First, we have the mouth. Inside the mouth, the tongues play a role, the teeth play a role, and also the saliva play a role in your mouth. So you don't need your saliva, dry mouth. That doesn't help with digestion. So you want to make sure your teeth are in good condition so you can grind your food, especially with the children who have problem chewing. We puree their food. That will help them with digestion, as also prevent choking. So you want to make sure you know your children, you know those who need help and those who may need a little more help than the norm. So that's where you'll see we recommend puree. Puree helps food to crush, and so it digests better and prevent choking. So the parts of the GI tract start with the mouth. Then we have the pharynx. Then we have the esophagus. And I'll show you as I go. So here we have the mouth. Inside the mouth, we have the tongue and the teeth, of course. We have, when it leaves the mouth, it goes to the pharynx. And from the pharynx, it goes to the esophagus. And right here, you'll notice the epiglottis. And this is the epiglottis. The epiglottis is a little lid. You know the song, open, shut them, open, shut them? Perfect. When you're taking a breath, it is open. When you're eating, it is closed, okay? It's a little flap that open and close, open to let air in and close, because the pharynx is used for 3 different parts of the pharynx. One, connect to the nasal passage to bring the oxygen in. Then the pharynx branch off. One, it branch off to the stomach, and this part that is not very clear here, it branch off to the lungs, okay? So your lungs is, your feel is in this area, breath is in this area, your windpipe, okay? So the pharynx go to the larynx and then also to the trachea. Most time you see children with trachea, it's right in the front here. Behind that, that's where you find this is where you'll find the esophagus, okay? All right, so let's get going now. We're gonna focus on the food now. I'm just telling you the difference between the airway and the difference between the GI tract, and that's why children choke, especially if they're talking or laughing or do anything like that during eating, they can choke, okay? So make sure, because it open and close, the lid open and close to let air in and close to get the food in, okay? All right, so we go from the pharynx, we go to the esophagus. The food comes down to the esophagus. Then it goes into the stomach. And this is the stomach. In the stomach, it stays there for a good 4 to 5 hours, depends on what you eat. Fruits get out in an hour, okay? Fresh fruit, within an hour, that is out of the stomach. Carbohydrate, which you call your cereal, your bread, those light stuff, we call it simple carb, they're out in an hour to 2 hours, okay? Your fat, your protein, they stay a little longer. And so that's why we encourage, especially you're doing with weight loss, to make sure you have fat and protein in your diet so the food stay a little longer in your stomach and you don't have that craving and you're not as hungry, because the cereal, the light stuff, they come out in no time. 2 boiled egg will stay longer in your stomach, or scrambled egg will stay longer in your stomach than a bowl of cereal, okay? So just keep that in mind. If you had flaxseed and chia seed and stuff like that, that will stay longer because that's fat, okay? All right, it leaves there, and when it leaves there, it goes to the small intestine, and this is where the absorption takes place. And once it absorbs your nutrients and take the food out, whatever it needs, it takes it out right here and then absorb into the bloodstream. Now, one thing absorbed quickly in the mouth would be sugar. When you get sugar in your mouth, it goes quickly into the bloodstream. It absorbs through your mouth and your tongue and palate, and it goes straight to your bloodstream. That's why when somebody have a high or a low blood sugar, we give them something sweet in liquid form. And so you said right away, it goes straight to the bloodstream. The same thing when you're eating sugary product. What is it doing? It going straight to your bloodstream. So you want to be careful with sugar and juice and things like that, because that go directly to your bloodstream. And so that's where absorption start, digestion start in your mouth, okay? The second phase is in your stomach. And then the absorption states take place in your small intestine. Then when you get to the large intestine, it absorbs 2 things, water and sodium. That's the last set of things to absorb. And then of course, it stores your fecal matters and send it out, okay? So that's basically an idea. So I'm gonna go through each organs and its functions, okay? All right, in the mouth, you know, the teeth is responsible to grind the food, crush it in smaller particles so it aids digestion and make digestion quicker. If you don't chew your food properly and fine, you will have problem with your GI because it will stay there for a while before it breaks down. The faster you're in the clot, the smallest the food can be, it's the fastest digestion take place. The bulky food doesn't go through quickly. So make sure you chew your food and encourage your children to chew their food properly. The mouth also with the tongue mixed with saliva start digestive process, and then the tongue push it back into the esophagus. And so that's what continues. Okay, so the first place is it. The liver, the gallbladder, and the pancreas also play a role, okay, in food digestion. The GI tract is responsible for digestion, ingestion, absorption, and excretion. So it responds for all 4. Ingestion, which is in the mouth. Digestion start in the mouth and end up in second phase in the stomach. Absorption in the small and large intestine, and then excretion. The liver, as I said, the gallbladder, and the pancreas, and the kidney also play a role to remove waste and add hormones that break down the food. Food journey through the digestive tract, through the mouth to the anus is 35 feet long, and it takes about 10 hours to be excreted. The food in the mouth process begin digestion. Digestion start before you take it the first bite. Digestion start before you take your first bite. Can anyone tell me how? By your smelling, okay? The moment you smell the food, saliva release, okay? Ready for the food. You put it in your mouth and then digestion starts. So digestion takes place before you start your first bite, just by smelling your food. And so this is important for your senses to be intact so you can function well. As again, I said, zinc help with your sense of smelling and your sense of taste. So if you're not taking your zinc daily, and you have a common cold or the flu or anything like that, you will lose your taste bud and your smelling as well. So as you start eating the food, start smelling the food, saliva increase. The saliva, as you chew the food, saliva mixed with enzymes to break the food down. It goes from your mouth to your pharynx, from your pharynx to your esophagus, and your esophagus is about 25 centimeter long. So it's about from here all the way to your stomach, okay? So it's about 25 centimeter long. Food leaving the esophagus goes straight to your stomach. And in your stomach, it stays there for 3 to 4 hours, depend on what you eat. Where it is added enzymes and hydrochloric acid. From there, it goes to the small intestine where absorption takes place. Food change, like protein, change to amino acid, fat change to lipid, so things that are easily digested, vitamins and minerals. And this small intestine is about 22 to 25 feet long. So there's a lot of place it has to get to going. So you have to make sure you have enough water to help with the flow and to get it through quickly. The large intestine, once it gets there, is where the water and the salt absorb. Again, water and salt is absorbed in the large intestine, and it also stores the fecal matter. Now let's take a look at the stomach, because I know a lot of us see children with G-tube disorder, so they may have a G-tube, okay? I want you to look at the top here. This is known as the fundus. And this fundus prevent these children from vomiting. See? If sometime it is surgically done. You see where the line's going? That's where they would do the surgery to make sure this child don't vomit a lot or have acid reflux. Not all of our G-tube students have it, okay? The best way to know if a child have a fundo is to look at their stomach, upper stomach. They will have a line going, a surgical line going across there. And that you'll see that some children have it, some don't have it. The one who don't have it are prone to nausea and vomiting. And so that's why when I give them their G-tube feeding, I ask you to keep them upright for an hour, 45 minutes to an hour, to prevent the food, because it's liquid, it will flow right back in the esophagus and they will throw up, okay? I just wanted you to have an idea what the stomach look like. And so this, the doctor will do the surgery to prevent this child from vomiting, okay? And children who have acid problem, they may do that for them as well, okay? And this is the body of the stomach. This is where the food leave from the esophagus goes into the stomach, and this is where it leaves and goes into the small intestine, okay? And these are have various sphincter muscle that contract and push the food in and out. And this contraction takes place every 3 to 5 seconds. So it's constantly contracting, okay? Just like the heart is constantly beating, the same thing with the stomach, it's moving. And each time it open and close, it's letting food in and out. And sometimes air, right? Because a lot of people do get gassy. So something is moving there. I always tell some people, it's either food or gas. One or the other is gonna be in that stomach. So make sure you put your food in the stomach. I'm gonna quickly go over some GI disorders. And so I'm gonna talk to you about some GI disorder. Again, gas is one, constipation, diarrhea, all these are GI disorder. Now, the first one we're gonna look at is GERD, because most of our children do have GERD, G-E-R-D, okay? It's gastroesophagus reflux disease, and most time these children will throw up, okay? Even if they have a seizure, chances are these children will throw up if they have seizure as well as gastric problem. The next one is acid reflux, and both GERD and acid reflux have the same symptom. It's like a burning on the chest, and they call it heartburn. It's just the acid coming back up, and that can also lead to ulcer. So it's so important for you to make sure you protect yourself and your children when they have acid reflux and GERD, because it can lead to bigger problem. find out the triggers. Sometimes certain food triggers these. Spicy food, something that is high in acid like tomato sauce or tomato paste, those may trigger. So find out what are your triggers. Some people it's soda, caffeine, anything like that may cause a trigger for acid reflux as well as GERD. Then we have gallstone, and this is too much cholesterol on waste pile up in the bile, and this can lead to gallstone. And this can be treated with medication. Some may be, if it's too large, then you have to do surgery. Again, here comes the importance of having your water to flush these things, because if it was a small one, your water would have flushed it out. Celiac. And these are children, I think some of our kids do have these problems. They do not digest gluten. And so celiac is those who do not digest gluten. What is gluten? Gluten is like a sticky substance found in, it's a protein and sticky substance that make the flour get the dough, you know, have that elasticity. But that's just gluten, that's what it is. It make the flour, the dough elastic. And so that's what gluten is. And so you'll find that in your bread and your pastry and your dairy. And so there's children who cannot eat this. They will have diarrhea, vomiting, anything like that they will have. So you said they put them on a gluten-free diet, okay? And so these are treated simply by removing the gluten, and the problem is solved. And so again, know the triggers. If you have a child that just eat like 11 o'clock and by 1 o'clock he's in the bathroom or 2 o'clock he's in the bathroom, chances are he has something that he's not telling, because it's supposed to be there for a good 10 hours, 4 hours at least in the stomach, okay? So especially with children, the small, because they're a little smaller than the adult. And when I give measurement, I'm giving an adult measurement. Children are smaller, okay? As they grow, their body grows with them, and so does their GI tract and their stomach. Okay. Crohn's disease, maybe you know a lot about that as well. It's an inflammation of the bowel. And inflammation, that means it's red and inflamed. It can lead to bleeding, GI problem, vomiting, diarrhea, you know. So, and sometimes they have a combination of vomiting, diarrhea, as well as constipation. So it depends on where it's affected. The upper GI, you will see more heartburn, more reflux, more gas, more bloating. The lower GI, you'll see more constipation, diarrhea, and blood in the stool. So these are the things you look for. You look at the color of the child's stool. If there's any concern there, please let the nurse know. Please let the parents be aware. Parents be aware as well. If you give your child something green that morning, that's going to change the stool color. So these are the things that, you know, so not to let your parents, you know, if you give the child something, let the teacher know, let the staff know, so that they're not alert, so they'll call you when it's unnecessary, when they did give you something green or some spinach that morning. And so one of the things I do when a staff asks me, Miss Judith, the stool is discolored, I first find out from the parents, what did they give them? And with these children, they eat a lot of things with dye. A lot of their snacks and their cereals and different things have bright colors. And so that can change the color of the stool as well. So the first thing you want to know, what did the child consume? Because you don't want to assume the worst when it's just because of what he or she ate. Another one is ulcerative colitis. And so that again is another inflammation. So the difference is some are disorder and some are inflammation. And it's good to know the difference. Inflammation is irritant, anything that irritates the stomach. And that can be easily fixed by removing the irritant that caused that. So, and some can need to be medicated, you know. So for colitis, you need to remove the irritant. And this may be wheat, you know, so you have to use dietary measures to change these. Sometimes it may be a bacteria that caused the inflammation. So again, you need to see your doctor. The doctor will decide if this is bacterial, if it's viral, or if it is just from an irritant. Irritable bowel syndrome, again, another inflammation. And this is, again, you'll see signs like abdominal pain, bloating, diarrhea, constipation. And again, these need dietary measures. Find your triggers and remove the triggers. Now, there are other diseases like ulcer, constipation, diarrhea, Fatty liver, that's another problem. It's getting a big issue now. A lot of people have fatty liver, so therefore they don't digest their food properly. It's also leading to a problem with diabetes and different things. Sometimes high cholesterol just because your liver is fatty. And something, just a flush will take care of that. By removing certain products from your food may take care of that as well. Those who are dealing with cancer, liver cancer, cirrhosis of the liver, liver cancer, liver damage, you know, that is jaundice. You'll see the eyes is yellow. And so different things you'll see when you come onto the liver. Not only that, this can be done caused by alcohol consumption. So person who drink a lot of alcohol can destroy their liver. A lot of medication, by having so much medication, that can also destroy your liver. So you want to make sure you're aware of these things. There's a few things, there's herbs that are good for the liver. So you want to see an herbalist as well as a nutritionist, and they will help you to clean your liver and remove these toxins. Milk thistle, that's a very good herb for liver. So anybody with liver issues, milk thistle, or those who take a lot of prescription medication, milk thistle is very good to clean the liver. Cancer, hemorrhoids. And so you see all these lactose intolerant, and a lot of our babies, including myself, we are lactose intolerant. What we know from studies, those people who are lactose intolerant also have some problem with gluten, and it is overlooked because they only think it's dairy related. Sometimes it's gluten related, and sometimes it's both. So if your child is lactose intolerant, see how well they tolerate the wheat. Because there's a specific child at school right now that whenever she eat the wheat, and mommy didn't know that was a problem. She said she was only allergic to dairy, and she didn't give her dairy. So why is she still having diarrhea? Only to find when she have pasta and things like that, she's also going frequently to the bathroom. So she's also allergic to wheat, and we just discovered that, okay? And so these things will go undetected. Sometimes it's a teacher that find out what's going on. Sometimes it's a staff that find out. Parents are not aware. They just assume, oh, maybe it's the food, or maybe, but it's certain specific food like gluten, things with gluten, macaroni and cheese, they will maybe have a reaction. And so you'll see by taking close attention to what your child eats and see what comes out, then you'll have an idea what is going on with your child. Because something as simple as can be fixed is just by removing that food. Again, the upper GI, signs and symptoms, nausea, vomiting, acid reflux. It may feel like what is called on heartburn because the food is not digested. So the food intolerant, appetite, diarrhea, constipation, itchy skin and rash, and some of that you'll find early when child have allergic reaction or allergies. Abdominal pain, bloating, coughing. Sometimes they cough and sometimes they wheeze because what? That acid came back and it gets into their respiratory tract. So that's why it's so important that we monitor these children who are having nausea and vomiting, because sometimes the food particle get into their respiratory system and they may cough or they may wheeze. And then they may also have dental problem because all that acid from their stomach is now on their teeth, and that is destroying the enamel. The lower GI would be abdominal pain, swelling, unexplained fever, nausea, vomiting, rectal bleeding, constipation, and urgency to use the bathroom. So again, it is important that you see your doctor so they can describe, are you having an inflammation? Are you having an irritant? So these are you having like allergy reaction, so you know exactly what to treat. Again, when you're eating, do not drink when you eat. Drink 45 minutes before meal and 45 minutes after meal. Why? Your stomach is a warm environment and it has hydrochloric acid, okay? When you put this in your mouth while you're eating, you're now neutralizing the acid. And so a lot of people having problem with antacid and all these stuff they take, they are neutralizing the acid. It can be simple fix. A simple thing is a little pinch of baking soda. Put that in your water. that add acid to your stomach. And you can do that early in the morning. Apple cider vinegar, make sure you dilute it in the water. A tablespoon of apple cider vinegar in 8-ounce glass of water, and that will add acid to your stomach, okay? So there are little things that can be fixed. And again, drink your water, but drink water appropriate time, not while eating, because you need those hydrochloric acid to do what? One, it kills the bacteria. So by eating, especially if you eat out, you don't know what's in the food. So somebody may have gotten some bacteria in that food. It get in the stomach, and the hydrochloric acid will kill that bacteria. It will also kill virus, including the coronavirus. Why? Because it's very acidic, and you did not neutralize it before eating. See? So it's so important that you drink your water at appropriate time. So your food needs to be in a warm environment, because it's going to a warm environment. So if you eat warmer food, you'll notice digestion take place faster compared to cold food. Colder food shock your system. You got to sit there for a while. When you gulp down some iced tea or some coffee, iced coffee, or some soda, that's going to stop the stomach from moving, and it sit there for a while to get back to that warm environment. So it have to build back again, and the food sit there and rot while it sit there and break down. Then it get back to the warm environment and start the digestive process. So that's why it's so important that you know when to eat, when to drink, the appropriate time to eat and drink, so you can get the full benefit of your hydrochloric acid that protects you from harm, sickness, disease, virus, bacteria. It is acidic for a reason. The only place of your body should be acidic is your stomach, because it's doing a purpose there. It's breaking down your food. It's destroying harmful bacteria that can harm you and also make you sick. So it is so important that you know when to eat, how to eat, and when to drink your water, okay? Have a great day, boys and girls. Mom and dad, be observant. What goes in your mouth, it affects your health. Bye.
Okay. Miss Mina, I have you highlighted right now, but Miss Tracy, you can make it along with her too, and then I'll switch back between.
Okay, no problem. Sure.
What happened? All right. When you're ready, Miss Mina.
Okay. Okay. Sorry. Baby. So we're gonna be making our bear. So it'll be in this bag, the paper plate, and some brown paper. Do it? Okay. Okay. So inside your bag, you have a little nose. How cute. And this is the tongue. I have two of these. I think I'm only supposed to have one.
No, it's two. It goes on inside of each ear.
Oh, it's the inside of the ears.
Yes.
And here's the actual ears.
Yes.
So I'm just laying mine out first before I actually put the glue. So it'll go inside the ear like this.
Yes.
And then we have googly eyes. Everybody loves googly eyes. And then all these loose brown pieces is basically just like the skin. I'm gonna put that on first to fill in the bear. We just put them kind of like randomly. I'm actually gonna put my nose on right now just so I can have a place marker.
Yeah.
I don't want like to put the other pieces in random places and then I gotta put the eyes and stuff. So this past Friday, me and Delilah went to Lion Country Safari, and bears was really the only thing we didn't see. So now we're doing a bear.
What are some of the other animals that they have?
They have giraffes, chimpanzees. They have what's those, like the deer, but they're called something else. We've seen the
Reindeer.
antelope.
Yeah.
We've seen lemurs, rhinos. It was really nice. Ostriches. The ostriches come right up to the car. They're like, you're not supposed to roll down your windows or feed them or anything, but they come begging to your car because I guess people do feed them anyway.
Other people, yeah.
They tried to bully us.
That's a good activity for parents, especially the fact that they get to stay in their car. They don't have any contact, you know?
Right.
Right.
It's the perfect thing to do right about now with everything that's going on. Like no contact at all. You're in your car the entire time. They have everything else closed. Because usually it's an amusement park.
Mm.
What's the cost? 'Cause I know it's
They're
been a price.
discounted right now. So it's only $19.99 per
Oh, that's
person.
good.
But
Nice.
under 3 years old is free. So Delilah was free.
Oh, right. I think I may take my son there at $19.
Yeah.
$19.
Delilah,
It's
did you take
usually
my
30-something dollars, you know? I think
Right.
$30-something dollars.
It was nice. Get her out the house. She hasn't been to the park. So parents, that's something nice you guys can do right now, especially with us doing the zoo this week.
And the fact that you get to stay in your car, you don't have to go outside and touch anyone and anything like that. Bring a snack
Right.
bag.
Contacts. Mhm.
And they tell you to bring binoculars. Make it a whole nice little experience.
That's cool.
I know they have a lot of birds. I remember the time I went, there was a lot of birds.
They are.
Did you see any giraffe?
Yes, the giraffes were so beautiful, but they were like statues. They don't really move a lot.
What about lion and tigers? They have any?
We've seen the lions. The lioness were closer, but the big lions, they keep them caged.
Oh, okay.
I was robbed for my googly eyes, guys.
Uh-oh.
She moves so fast, like she put them. So that's probably the only thing that would be missing with the googly eyes. But you know what? I have another bag because I have bracelets.
How's yours going, Miss Juana?
I think I'm missing something.
You're missing pieces.
Oh,
Okay.
Oh, look at
that
Miss
is
Juana's
cute.
googly eyes.
I like yours, Miss Juana. You have a polar bear.
I have a spare googly eyes.
Did I miss anything? No, right?
There should be some like little brown pieces to make him
No.
brown.
Just his color.
Ah, okay, that's what it is here.
That's what's a polar bear.
It is- Okay, I see Miss Tracy.
Yeah, without his brown, he's a polar
Yeah, he-
bear.
Right.
Okay.
You just have to put the paper around it to fill in the face.
Polar bears are in the zoo too, so
Yep.
we'll have different types of bears.
Miss Warner got herself a polar bear.
Polar bear, brown bear,
Right.
black bear.
Yeah.
I think is what does Florida have? Black bears, I think.
Yeah.
Yeah, we have the black
And brown.
bears.
Not black bears.
If you go out towards the Everglades, out
Mhm.
that way, you will see polar bears out there. The little bit black bears out there. If you
Yeah.
go like on the Indian reservation, you will see the
That's
black
so
bears
cool.
out there.
They have black bears out now.
Yeah.
So Delilah is helping me now.
That's nice.
Oh, good job, Delilah.
Her motor skills going.
Okay, you like it? Oh, okay. The teddy bear. You know the teddy bear song? Teddy bear, teddy bear.
Yes. Yeah. It's like it's mine.
Yeah. Yes, only child syndrome. She'll grow out of it. Sharing is caring.
Soon as she get to school.
Yes.